Pronouncing it right again, Hagseth, which is a Norwegian name, is going to be speaking with us today on sexual and reproductive health policies in Missouri. And this is, of course, very timely. Mandy's had 15 years experience in health, rights, and justice as the Director of Policy and External Affairs at Missouri Family Health Council, which, as some of us know, is also where Martha works. Martha's her boss. This is Martha's boss. She's held various roles since joining the organization in 2017. She previously managed a diverse issue portfolio of social justice coalitions as the director of community collaboratives at Community Partnership of the Ozarks in Springfield, Missouri. She's also worked on reproductive and maternal child health initiatives in the Dakotas, and as this is very interesting sounding, Upper Midwest Human Rights Fellow to the UN Women Country Office of Liberia. She has an undergraduate and law degree from the University of South Dakota. We're very excited to have you here today, Mandy. Thank you for being here.
Well, thank you, Alice, and thank you all for the invitation and spending your lunch hour hearing about sexual and reproductive health care access and policy here in Missouri. I'm going to actually go ahead and share my screen. I do have a PowerPoint presentation just as a visual grounding for our discussion today. But after that, I will go ahead and end the PowerPoint so we can all see one another more easily, and I'm happy to field some questions or additional discussion. So let's see if I can share my screen easily here. Okay, can everybody see the screen?
Yes, we see it.
Great. That's always the first challenge, isn't it? Okay, well, as Alice said, I am the Director of Policy and External Affairs with Missouri Family Health Council, an amazing organization that I couldn't be prouder to work for. And let's see if we can, there we go. Okay, so here's just a little bit of a roadmap of what I will be covering today. I'm super excited to tell you about Missouri Family Health Council. I jokingly sort of call us the best kept secret in sexual and reproductive health care in Missouri. Not a lot of people have heard of us, but we deliver some very important services and programs across the state. And I'm excited to tell you a lot more about that. Of course, we're going to talk about the challenges of the current landscape, both on sort of a state and national level. And then I have a lot to say about the Missouri legislature and sort of a status update of some issue areas that are among our policy priorities and particularly important under the sexual and reproductive health banner. And then, of course, I want to talk to you all about what you can do and how you can help advocate for these issues. And then, like I said, I'm happy to address questions or clarify anything that might raise any questions throughout our discussion today. So Missouri Family Health Council is a nonprofit organization. We are headquartered in Jefferson City. This is my home office, but I am just a handful of blocks from the Capitol. And then we have an office across town. We were one of those offices that we were not remote prior to the pandemic, but we became a fully committed distributed remote team during and have hung on to after the pandemic. But this is our mission statement here. We champion access for every individual to culturally sensitive, quality, sexual and reproductive health education and services. And we do that through programs or program initiatives, and then we do that through advocacy. So the kind of headline program and what we're mostly known for is that for over 40 years, Missouri Family Health Council has been the sole grantee for the Title X Federal Family Planning Program here in Missouri. And so you may or may not be familiar, but the Title X program was established in 1970 under the Nixon administration. And it includes services like contraceptive access, well people exams, cancer screenings, STI testing and treatment, et cetera. And it is a safety net program that particularly reaches folks of low income or that are or underinsured. And then a couple of years ago, and this is actually when I came on board with Missouri Family Health Council, we expanded the scope of our programs and became, in addition to Title X, the program office for what at the time that I was hired was nameless, but has now become the Right Time Initiative. So this is a state-based contraceptive equity initiative. So Title X is a federal program. The Right Time is a state-based program, and it's funded by Missouri Foundation for Health. And it is premised on what you see here on your screen, the simple idea that everyone should have the opportunity to pursue the future they want, including if, when, and under what circumstances to become pregnant. So participating health centers all across the state deliver one or both of these programs. We have approximately 80 clinic sites. Actually, I think this might be my next slide. Yes, we have approximately 80 clinic sites all across the state, ranging in type. It's very diverse. We've got county health departments, federally qualified health centers, community action agencies, hospital-based clinics, and standalone family planning providers, including Planned Parenthood clinics. So if you see here, the two dots that we have in Cole County are the Cole County Health Department and also the Planned Parenthood clinic in your area. But you can see that we cover a vast majority of the state, though I think it's important to also point out that you can see pockets in kind of the South Central and sort of Midwest area of the state that still have some what we would call sort of contraceptive deserts or less access. But we're proud that we cover the amount of the state that we do with our program initiatives. So we ourselves don't deliver the direct services. The funds flow through our organization and out to this network of providers.
Your chart shows 2 dots for Boone County, but none for Cole.
Yeah.
So
yeah,
you meant to say 2 in Boone County.
Oh, I'm so sorry. Did I misspeak? Yes, I meant Boone County.
Okay.
I live here in Cole County. Maybe that's what I was thinking. Yes, Boone County. And that's the Boone County Health Department and the Planned Parenthood Clinic. Thank you for that correction. And then in addition to our programs, we also have kind of a burgeoning advocacy department. And as you can see here, we advocate for increasing health equity and access. And we do that through 3 things: stakeholder engagement, mobilization, and also advancing a shared policy agenda. And that shared policy agenda includes things like safety net programs, including Medicaid and the Women's Health Service state-based family planning program, advocating for LGBTQ and racial equity and access to healthcare, increasing contraceptive access and contraceptive equity, increasing access to STI testing and treatment, and a host of other things. We try to have a proactive agenda, which I'll talk a bit about when we get to the Missouri legislative update, but we also defend against attacks to the health safety net, to the Title X program, and to access across the state. So let's talk about the current, this is what I'm sure everybody's maybe the most interested to talk about or hear more about, and that is the landscape in Missouri and sort of nationally. So as Alice pointed out, that is completely correct. It was 6 minutes. Both the Attorney General and also the governor quickly behind issued their opinions that enacted the Missouri trigger law right after the Dobbs v. Women's Health Organization ruling came out of the United States Supreme Court. It was June 24th, 2022, a day that is seared in many of our minds, and abortion has been unlawful in the state of Missouri since. I believe it's a Class B felony, punishable between 5 and 15 years. At that same time, you all may recall that that sort of created a snowball of what has maybe been dominant since: confusion and misinformation. Particularly at that time, you may or may not remember, St. Luke's in Kansas City stopped providing emergency contraception to victims of sexual assault, thinking that birth control too was made unlawful by the decision. So offices like ours and people in this space have really had to contend with a lot of confusion, the chilling effect that these sort of legal matters have, and the significant impact that this has on patients and providers. Providers too are confused. They don't know what they can say, what they can't say. Patients don't know what is lawful, where to obtain services. And so it has been an especially difficult landscape to connect people with necessary services, probably even before, like for all intents and purposes, Missouri was kind of a post-Roe state even before the Dobbs decision, because abortion had been restricted out of reach for so many, but it became officially unlawful after the Dobbs decision. And so that was maybe the tip of the iceberg, as we also have seen in the last week, a week ago today, a dueling, conflicting set of federal orders coming out of the federal courts in Texas and Washington over the approval process of mifepristone, which is an abortifacient, which I'll talk more about here. It's part of a 2-drug regimen that's used to terminate an existing pregnancy. That has created a very fast-moving, complex legal battle that even from earlier this morning to this presentation today, there have been additional developments. And then you all may have also seen that the Missouri Attorney General, Andrew Bailey, has also published an emergency rule that's seeking to limit access to gender-affirming healthcare in the state of Missouri. And I'll talk more about both of those, but this is, I think, to situate where Missouri is regionally and nationally. This is a point in time interactive map that you can access from the Guttmacher Institute. The web address is down in the bottom right-hand corner. As you can see, Missouri is part of a swath of states that is among the most restrictive. And you can also see that states like Kansas, New Mexico, Colorado, Illinois, and even over kind of further east, I think that when I see this, it's always really helpful because it clarifies to me the challenges in access in the Midwest and South, and how those more protective areas are more difficult to access. And so this is actually as of last Sunday, but it continues to develop. Just yesterday, I was reading that Florida had passed a 6-week ban. And so this is going to continue to evolve or change, but the Guttmacher Institute's interactive map is a great place to reference because they keep it fairly updated. And so, like I said, this is from just last Sunday. So to talk about kind of the mifepristone issue, again, I just want to highlight, this is a really rapid moving and complex legal battle. And it's stemming from a challenge that was brought to the approval process of mifepristone, which, as I said, is a 2-drug regimen that terminates a pregnancy during a medication abortion. So most recently, the Fifth Circuit Court of Appeals, or an appellate court, preserved sort of limited access to the drug while the matter is being litigated. But this morning, the Department of Justice and Danco Laboratories have both petitioned the United States Supreme Court for emergency relief. And also the Washington ruling, the DOJ had sought a clarification order from the Washington judge, and that clarification order, or the clarification came out this morning and is sort of suggesting that access should be fully preserved in the 17 states and DC that are in its jurisdiction. So conflict here, and very complicated. But I think some important things to point out here are that mifepristone was approved over 20 years ago this is a blatant ideological attack on science, on the law, and on sexual and reproductive health access, specifically abortion. Today, we know that the fight is over preserving access to mifepristone, but as we have seen here in Missouri just a couple of years ago, it's going to be about birth control, including emergency contraception and IUDs once again, as it was in 2021, when the Missouri legislature sought to inaccurately reclassify emergency contraception and IUDs as abortifacients and ban them from the state Medicaid program. That issue only narrowly failed, and it only did so after threatening stability of the entire state budget and forcing a special legislative session. So I think a few additional things to note. We want to make sure that because of the amount of mis and disinformation, that mifepristone is an abortifacient. Emergency contraception, also known as Plan B or the morning after pill, is a different medication than mifepristone. They are not the same thing. Emergency contraception is taken after sex, and it prevents a pregnancy from occurring. It does not have any sort of impact on a pregnancy that has already occurred. And all methods of birth control, including EC and IUDs, are legal and available today in Missouri and nationally. We do expect future challenges because of the environment. And I think this quote from the Danco Laboratories motion, I think really sums up just how anomalous this challenge to mifepristone is. They say, this decision is an extreme outlier. No court has ever stayed or suspended the longstanding approval of a drug consistently found safe and effective by the FDA. The court's mandatory injunction is an unprecedented judicial assault on a careful regulatory process that has served the public for decades. So again, Danco Laboratories is really pointing out here that this is a purely ideological attack. And I think we should all be very concerned about the slippery slope that is ideological judicial attacks on not only the regulatory process, but on any sort of medication or drug that folks are opposed to or have some sort of conflict with. And so this is highly anomalous. It's unprecedented on multiple levels, but I would love for all of you, if you walk away from this conversation today with anything, please help us lift up. Mifepristone is not the same thing as emergency contraception. And while the complex litigation plays out, so the Fifth Circuit did say that mifepristone limited access would be preserved. And what that basically means is in states where abortion is legal, mifepristone can be used. They're suggesting that it be dialed back to in-person use only, and only up to 7 weeks gestation. It was previously 10 weeks. Because abortion is unlawful in Missouri, that is not a consideration here, but all methods of birth control continue to be legal and available at Title X and the Right Time Health Centers all across the state of Missouri. And at the end of my presentation today, I have a few links that I want to share with you about where you can direct folks in your area for services and additional information. So I want to talk about kind of narrowing the scope just a touch. I wanted to share with you a point in time, an interesting time too, about the Missouri legislative session. So we are about, I think, 3 weeks, no, I think if we're finishing this week, there's 2 weeks left for the budget and 3 weeks for all other business. Session ends on May 12th, and legislators have not gotten a lot accomplished so far this year. So these next few weeks are going to be extremely active, and there's a lot of escalating tensions that in terms of sexual and reproductive health can be helpful, because the more time that there's infighting, the less time there is to further restrict access to sexual and reproductive health care. But really anything I think could happen in the next few weeks. But here's what we do know. Here are the big, what I would call sort of the big headlines so far this year under this banner of our work. There's been assertive attacks on diversity, equity, and inclusion. You've probably seen a lot of headlines about everything I'm mentioning here because the media has well covered it. There's been additional prioritizing of barring qualified providers from participating in the state Medicaid program and also generally attacks on Medicaid. There's been what I would call next level attacks on LGBTQ plus Missourians, particularly trans youth. There's been some unnecessary drama and a bit of a nail biter on postpartum extension of Medicaid from 60 days to 1 year. There was some language that was attached to one bill that all but ensured that CMS approval would not be given. I'll talk a little bit more about that. And then sadly, a stagnant contraceptive equity agenda due to low or no appetite. And so under the DEI banner, I just want to note that in the House, there was a very broad sweeping amendment that sought to limit diversity, equity, and inclusion, I think in all state programs and contracts, that was attached to all 15 budget bills. That is now the budget is now going to be taken up by the Senate. The Senate has said that it will start from a place of removing these amendments as it takes up the budget this coming week or in the following. But there are also some standalone anti-DEI measures that are also advancing through the process. One of them is specific to higher education, and the other is a broad healthcare related measure. And so they're still attached to the budget, though the Senate has said that they're going to remove them. And there are also standalone measures that are advancing. Similarly, these sort of provider exclusion or free choice of provider in Medicaid or Planned Parenthood defund measures also exist as amendments in the budget and as standalone measures. So despite another court ruling that reaffirmed that it's unconstitutional to include this provision in the budget just this past December, the Missouri House once again has included it. And here again, there is also a standalone statutory measure, meaning it's not in the budget, that is also advancing. And so what this does is it bars qualified providers from providing non-abortion services like birth control, cancer screenings, and well people exams under the state Medicaid program, which is in violation of Medicaid's free choice of provider guarantee. And as Missouri Family Health Council can attest, the need for publicly funded family planning services has outweighed the capacity of the health safety net for a long time. It's been underfunded, and we cannot withstand any additional provider losses. This is a very concerning recurrent effort that would have an impact on the entire health safety net. The attacks on LGBTQ Missourians and trans youth have been very aggressive, both in volume and in severity. Dominantly, this has taken the form of gender-affirming care bans for youth and also trans youth sports bans. But there's also been a mix of other items like these sort of don't say gay bills. One was introduced here in Missouri that was purported to be the most severe in the nation. But time and time again, the LGBTQ and trans communities have shown up, including for more than 9 or 10 hours was the first testimony, the first hearing that included a bunch of anti-LGBTQ measures. And this week there was a flurry of additional activity where there's a number of these bills that are moving. And there may be some tension between the House and the Senate versions of them, but this has just been tremendously difficult and exhausting for our LGBTQ Missourians, and the severity and volume really cannot be understated. But in the positive column, I guess, is that in what many said was the largest rally and visibility event ever to take place on Capitol grounds, a trans rights protest took place a couple of weeks ago and brought what the media said was between like 300 and 700 attendees from all corners of the state. And Missouri Family Health Council was proud to be among them. Postpartum extension, like I said, has just been needlessly dramatic this year. It's a universally supported bipartisan policy that was thwarted when extremist senators attached abortion restriction language to a bill that ensured the policy would run afoul with federal approval under the Biden administration. But I'm excited to share that this week, that language was stripped from the last vehicle containing it. However, as we have reported before and seen, and I'm sure you all have seen this too, a couple of lawmakers have been successful in the past in appending the process and unfortunately hijacking really good policy and preventing its passage. So though we remain hopeful, that will not be the case here. Like I said, anything can happen in the next couple of weeks. So Missouri Family Health Council and others are still working a proactive contraceptive equity agenda very hard, but time is running out. And at this point in the process, it does not seem that bills, so we have three, kind of a triad of proactive contraceptive equity legislation. The first is a measure that we call annual supply birth control. What it does is it requires private health insurance companies that are already covering birth control that they supply and fund an annual supply at a time. So this increases the continuity of use and reduces barriers that folks face in accessing their prescriptions. The second measure is pharmacist prescribing of birth control. So this just allows an additional access point. As when I showed the map of the state, some people see a pharmacist 12 times a year, but do not see a practitioner as often as they would like. Pharmacist prescribing would create an additional avenue to obtain birth control prescriptions and the methods that people use, the self-administered methods that people use. And then the third is the CARE Act, or the Compassionate Assistance for Rape Emergencies, a bill that increases access to emergency contraception for survivors of sexual assault. So the contraceptive equity agenda continues to, I'm still running around the Capitol and really trying to educate lawmakers about the issue and pursue other avenues to lift them up. But unfortunately, the appetite, the desire to increase access to contraception, even given the current landscape, still remains very challenged. And we have not seen much movement in those bills. So what can you do? So many things, but at the top of the list is provide accurate information and linkages to services. So mfhc.org is the Missouri Family Health Council website, and we've got a couple of sub-pages that I think are of particular value to you all. The first is our clinic finder, which you can find at mfhc.org/patients. So you can just type in a zip code and find which Title X or the Right Time health centers are closest to you or closest to anyone. And we also have, under kind of the patient banner on our website, we have an abortion resources document that also might be helpful. It includes a host of different organizations and resources, but I would lift up the logistical support that is funding and support to actually access out-of-state care, and also legal support. If, when, how a national organization has a legal repro helpline for folks seeking abortion that have questions about their legal rights, and that can be used nationally. So I would lift up both of those areas of our website as pertinent for everyone to try to utilize. And then, because we also advocate and send out action alerts and information about what you can do specifically, both on a state level or sometimes on a federal level, /action would take you to sign up for our Action Network. And I truly hope that you'll all do that with me at the end of the presentation today. We would love to have you be a part of our Action Network so you can take action in specific ways that would lift up sexual and reproductive health from the perspective of Missouri Family Health Council. And we love being social. Engage with us on social media. We're on Twitter, we're on Facebook, and we're also on LinkedIn. These are our handles here. Please follow and engage with us there. And though I know I don't have to tell this group this, but of course, voting is always chief among the activities that we can take to be involved and civically engaged in order to try to improve the issues that we all care about. And then I have a specific event that I can lift up, which is rare, and I'm excited about it. Next Wednesday, April 19th, we, along with Planned Parenthood Great Plains, which is the Planned Parenthood affiliate in your area, as I'm sure you all know, and so there's 9 organizations total, I believe, that are signed on to kind of co-sponsor Mo Rights, Mo Love, Missouri Lobby Day under the banner of sexual and reproductive health. So the event is actually from 2 to 5, but there's some time from 1:30 to 2 where there's going to be some organizations that are tabling, including us, that you can learn about some of these organizations and their contribution to sexual and reproductive health and access. And then we're going to have speakers, including Michelle Trebbiano, who is Missouri Family Health Council's excellent executive director, and also some Repro champion lawmakers. And then there will be a short training on lobbying for anyone who wants it. And then there will be some lawmaker engagement and session observation. So you all are in Boone County, which is just a step away here from Jefferson City and the Missouri State Capitol. So if you are able, we would love to have you join any part of the activities next week. And I will drop the link in the chat after I stop our PowerPoint today. So you can sign up there and join us if you are able. And so, yes, I will. I'm happy to add the date into the PowerPoint, Alice, so you can share that and it's included. I'm happy to do that. And then here is my contact information, both my email address and my cell phone number. I'm always here for questions or engagement if that is helpful. And I just really appreciate the opportunity to have joined you all today. Your interest and advocacy in sexual and reproductive health access, especially at this critical time, and Missouri Family Health Council. I'm delighted to have been here with you, and I'm also happy to continue the discussion and answer any questions.
Great. David, I see your hand first. Johnny on the spot.
Yeah, that's great. A couple of questions. One, you mentioned trying to get the ability for pharmacists to prescribe certain birth control items. Do pharmacists, are they allowed to prescribe other meds currently? That's one question. The other one, if you could help maybe expound a little bit more on your connection, your relationship with Planned Parenthood. That's throwing me off. Sound like when you started talking, it sounds like what Planned Parenthood does. And then it sounds like it's this network. Explain that just a little bit better or again for me.
Yeah, thank you. That's a great question. Let me clarify. So Missouri Family Health Council has a network of providers all across the state that delivers one or both of our programs. Planned Parenthood, both affiliates, both Planned Parenthood Great Plains, which is in mid-Missouri and the Kansas City area, and Planned Parenthood of the St. Louis region and Southwest Missouri, they are both participating health centers in one or both of our programs. So they're a part of our network. Does that clarify, David? So we're close partners. We also partner in advocacy as well, but they are part of a substantial part. I actually can't understate, because when it comes to the sort of Planned Parenthood defund measures, the biggest reason why this is so significant, even for folks that are not fans of Planned Parenthood provides an outsized amount of non-abortion family planning services across the state of Missouri. They, I believe last year, served 52% of our patient base was served at a Planned Parenthood clinic. And that includes both affiliates, but they serve a significant and outsized amount of patients across the state, even with the non-abortion services under Medicaid and our programs. And then the pharmacist question that you have, I don't fully know the answer to that, but I can say that a couple of years ago, a similar conversation had started around HIV prophylaxis. And so I think that there's like a burgeoning policy discussion around creating additional access points, or sort of folks like nurses, advanced practice nurse practitioners, and pharmacists practicing at the top of their licensure, to ensure that there is as many access points or a reduction in barriers as we could have. But I'm not as up to speed on some of the other areas of pharmacist prescribing opportunities.
You know, what comes to mind to me is they can give vaccinations. You can walk in and get a vaccination, which is a kind of prescription. So that was one thing that came to my mind, is a power that they regularly exercise.
Mhm. And Sarah, could I answer Catherine's question in the chat real quick
Oh, yes.
before we pivot
Yep.
over to Alice? Okay, Catherine is asking if Planned Parenthood is the only Medicaid provider that is being blocked, and that is correct. The way that the language is presented, it's abortion provider or their affiliate, which is just a way to say Planned Parenthood. So yes. And thank you, Dave, for sharing the website. And
then
Alice.
Alice, what did you want to ask?
Okay, so when the Dobbs Act was passed, they said no exceptions for rape or incest, but they did say to save a woman's life, but it was not defined, and there was urgency to define it, and hospitals didn't know what to do. Where is that at? That's extremely important, of course.
Yeah, I think that, I mean, and that's the issue in terms of, I think general counsels and others have still been navigating and assessing their own risk. And it has been a complicated area of the law for sure. I don't actually know. There was an EMTALA challenge that was launched a while back, but I do not know what the current status of that is.
So still not very defined and murky for providers.
Well,
Possible.
and I think here again, it's the chilling effect that these issues have. Even if legally permissible, people are very uncomfortable. Practitioners are uncomfortable, and often, you know, uneducated or risk averse counsel would advise, you know, less risk than, and so it's the chilling effect that always ends up being additionally problematic. But that's a good point. I want to check back in on the EMTALA challenge that had taken place, because Missouri was actually in a lot of national news during that time for that incident out of the Joplin area.
Right. Thank you.
David?
Yes, my niece in Indiana is dealing with infertility problems. She's in her late 20s, and she's convinced that her providers are kind of stymied by new rules to even help women in this category. Have you been hearing anything about those kinds of issues? Because people taking certain treatments have to deal with, I don't know, certain complications, and now certain procedures and things are forbidden, and it can put a kibosh on somebody's fertility efforts. Have you heard of this?
Yes, that has definitely been an issue. And I think, David, you hit an important point too, that after Dobbs, we're talking about 50 different states with 50 different sets of laws, and those that are restricting sexual and reproductive health care have variations on different laws and restrictions. And so, yes, that can implicate the entire spectrum of, or the entire continuum of sexual and reproductive health care, including fertility treatments. And so that has been a significant part of the discussion, I think, in Missouri and kind of nationally. Yeah.
Good.
Yeah, Herb.
Blunt question. What's wrong with Missouri women? Correct me if I'm wrong. David or you can correct me. But my impression that Missouri women, especially in rural and southern parts of the state, tend either not to vote in state races, or if they vote for white, racist men who persist in creating legislation and laws which restrict their human freedoms compared to other people in other parts of the country.
I don't have a lot to
That's a
say
blunt
about
question, isn't it?
that. I don't have a lot to say about that, except I'll say this. I think that at the heart of your question and frustration is there's no shortage, whether it's about sexual or reproductive health care and sort of the intersection of lawmakers and policy. It just continues to be so important for all of us to participate in civic engagement and educate our families, friends, neighbors, and really engage in discussions, especially in today's policy landscape, about the impacts and stories and effects that these policy changes have on people's real lives. And so I can't speak to people voting against their own self-interest, but I think it's incumbent upon all of us to continue to stay civically engaged and aware and lift up opportunities to create change.
Let's see. There was let's see. Kathy asked in the chat, if Muleskinners were to join your action network, what are the requirements, expectations of a member? Oh, and then Shemeni answered it. She said there's no requirement to be a member of the action network. It's like signing up for notifications. Okay, questioning it, asking and answered. Thank you, Shemin. Marie? You got it. You're getting it.
Yeah, I'm having trouble unmuting, but I'm unmuted.
There you go.
My question has to do with the contraceptive deserts around the state and whether pharmacists prescribing contraceptives would help to address that issue, or what other measures can be taken. Because I know they're not only in some cases contraceptive deserts, but healthcare deserts in general. So.
Yeah, I mean, we're certainly of the mindset that eliminating as many barriers as possible or creating as many access points as possible is where we need to be in terms of, creating service delivery points for everyone across the state. And so, these are the measures that I call them low-hanging fruits. Like, they're just easy things easy policy changes that we could make. Not so easy though when you're in the state capitol, but they are easy changes that would have an impact. And so certainly there are some other policy pursuits that could happen, but nationally, annual supply birth control, pharmacist prescribing, increasing access to emergency contraception in and beyond the emergency room. These are staple opportunities to create more access and eliminate more barriers. I don't know if that answers your question fully.
Yeah, I guess what I was kind of getting at is there any chance of over-the-counter access?
Yeah, and
You have to have a pharmacist involved.
yeah, and actually yes. I mean, I hope that we imagine a future where over-the-counter access is more seriously considered. I think, there are a lot of organizations that support pharmacist prescribing or don't support pharmacist prescribing because they do believe all birth control should be over the counter. So yes, I think that is an aspirational additional place that we could potentially land. But here in Missouri, we've been trying to create some of those access points. On the pharmacist prescribing legislation has been around since 2016. And so we've been working that legislation since then, or involved in it. And the annual supply legislation has been around for, I believe this is the 5th or 6th year. And so, the wheels of policy and justice turn slowly.
I see in the chat, Winifred asks, could you list the bills that will be the focus on the Wednesday lobby day? Do you know what?
Yeah, so I don't have a
talking about?
comprehensive list available in this moment, but I can tell you that they include many that I spoke to today. The diversity, equity, and inclusion measures, the free choice of provider or Planned Parenthood defund measures. And let's see, I think that there was, maybe it was the gender affirming care ban bills. And so those are just a sample, but they would be kind of the bills that are farthest in the process or that would have the most significant impact on access to sexual and reproductive health care.
Anyone else? Going once. Going
Um,
twice.
I
So David's
had
got
to
one.
step
Oh,
away
David.
for a minute. Did somebody address Kathy's question about Planned Parenthood as being blocked as a Medicaid provider?
Yeah.
Oh, that was way up. Yes, I missed that. That was a long time ago. Yeah, Kathy asked, is Planned Parenthood the only Medicaid provider that is being blocked? Thank you. I had forgotten that was up there.
And that, as I said, they are.
And then David.
I want to bring up an uncomfortable subject. It's an answer to Herb's question as to why, say, those women and other people would vote as they do. And it's a word that hasn't been mentioned, religion. You know, and it's painful to say that many religions explicitly instruct in matters involving sex that they have to battle Satan no matter what, according to the interpretations of their leaders. And here I'm talking about large groups like Mormons, Southern Baptists, and a lot of Catholics too. And I don't know, and by battling Satan, I mean they have to vote and do certain things against all logic and everything they know about biology and people, because they believe that God, if they do this, the Spirit or God will bless them, and bad things like wars and disease and having gay children will no longer happen. This is what we're battling, and I don't see how we can ignore religion, and I know that it's probably impossible to have alliances with religious organizations who are, of course, against this, because many religious people are against such thinking, but it is a dominant thinking. I mean, I can't tell you how many times people have told me that they believe that if they will just do these things as instructed, that God or the Spirit will take away the problems. And that's what they're going for when they vote for these obnoxious and horrible policies and these obnoxious and horrible people. It's hard for anyone well-educated to believe this because it doesn't even fit our idea of the deity or our religious tradition, but it is the truth. And I'm wondering if you have people in the family council who are aware of these truths and have any idea as what the hell we're going to do about it.
Certainly, religion and ideology affects access to healthcare, I think, in a lot of ways. I'm not sure I am fully understanding your question in the end, David, but I understand and experience the challenges. But as somebody pointed out in the chat, there are denominations that have differing viewpoints about not only contraception, but also abortion access and sexual and reproductive healthcare generally. And certainly we would argue that ideology and especially religious doctrine should not be a consideration in healthcare access for everyone, and that everybody deserves culturally responsive healthcare access.
So I think Alice is piggybacking. I'm not sure if I understand the question, but maybe it'll mean something to you. Could you talk about religious courtship and chances for its staying trigger law, a religious court suit, she said, court suit. And then I think Shemin maybe was talking about the same thing, the lawsuit about related to religious freedom that we know our local pastor Molly Hausch Gordon had signed on to. Are you up on that?
I don't think that there's been any development since it has been filed. And so I could be wrong about that, but I don't believe that there has been any sort of movement since the filing.
A question from the telemus?
Yes, from me.
Oh, there we are. Gotcha.
I worked in Jeff City for a long time with a lot of Catholics. And this was back a while, but so many of them were against abortion. However, they'd be pro telling the people in jail that had been, we could kill people that were prisoners, but we couldn't have abortions. So there seemed to be a logic there. But the bigger thing is a lot of what these and the controls now seem to be also meaning that you can't get a DNC in many states. And if you've got that, I'm wondering whether that's making some of these people that are saying no abortion think twice, because that impacts them also, unless they would never, I'm sure they had DNCs.
Yeah, and I think that that sort of goes along with the emergency challenge, that miscarriage management is also just a huge consideration in these restrictions. And we've seen and heard even that Joplin incident that I had mentioned, non-viable fetuses or miscarriage management is also impacted or implicated in some of these restrictive state laws. So yeah, I mean, I think certainly at, Dobbs only happened last June. It has not been almost now been in effect for a year. And certainly we have heard and probably will continue to hear as state laws are evolving or devolving in many cases, some of those additional areas that people are experiencing. So yeah, Sue, I definitely hear that. And I think that that's been part of the discussion, and likely one to become a bigger part of the discussion as things continue.
Thank you for being there, to being a source for people in the field to kind of keep knowledge available about what's going on and what can be done.
Our providers are excellent resources across the state. I would give them huge kudos, because really everyone in the healthcare space has endured some really difficult years, no doubt. And the turnover and burnout and so many things have impacted the entire health service delivery space. Family planning providers are, of course, no exception. Operating in this hostile environment is difficult, especially if you're on the, boots on the ground, delivering services, and we definitely give them kudos. I would also say that reminds me, just one important distinction I think to point out here. So I actually transitioned into this position in early 2020, and right on the cusp of the pandemic. And so I think it's important to note that this year, 2023, is the most normal Missouri legislative session that I have experienced, and being in the Capitol weekly has finally been a more comfortable sort of public health option to even meet with our lawmakers in person and feel safe or safer in doing so. And so it's not lost on me. And I think an important note that public health has greatly impacted not only the lawmaking process, but of course the entire healthcare field and family planning providers too.
And Mari and I saw through the years, because we both worked in Jeff City, she for the Department of Health and for me, OA personnel, that health department, their PR people, their lobbyists within the health department would get screwed, because if they did anything to support Planned Parenthood, so that it was pretty bad through the years.
I guess I have one other question, and again, I had to step away for a minute to take care of my dog. So if I miss this, just say so. But is there an ongoing struggle over control of the Title X funds? And is Missouri Family Health Council is there any guarantee that you will continue to be the grantee, or could it turn into the money going to the state, in which case it would be administered very differently?
That's a great question. And yes, the state has competed with us at Missouri Family Health Council for the past couple of grant cycles. However, based on our exceptional and proprietary method of running the program, we have been victorious in securing the grant. There is no guarantee, however, that that would continue to be the case. However, we do believe that our administration is, as has been shown in the awards that we've received, exceptional. But yes, I think that they'll continue, especially depending on what the state administration looks like and then what the federal administration looks like. We expect continued competition, but hope that we will continue to prevail, but not
And
guaranteed.
Is this type of arrangement common among states or?
It looks different in different states. There's a handful of states like Missouri that have like a family planning council. And then in some states, it goes directly through the state. In other states, it goes in chunks to different specific providers. So it looks different in different states, but I don't know how many states have family planning councils like ours, but we are among a group of states that have a similar setup. Yeah, thank you for that important point, Shemin.
Okay, well, thank you so much for spending your lunch hour. Hopefully you got a chance to eat before, or you can grab something now. But yeah, very informative, very timely information. We'll make sure and spread the word about your lobby day. Thank you so much for being here, Mandy. We're going to move on to our regular meeting, but I see lots of clapping. You're welcome to stay, but understandable. You probably have things to do.
Yeah, thank you so much. I am going to take off, but thanks again. Really
Great.
appreciate it.
Thanks for being here.